Welcome back to another episode of Confessions of a Male Gynecologist. I'm your host and author of the Hormone Balance Bible, Sean Tassone, America's Holistic Gynecologist, board certified in OBGYN and some extra training in integrative medicine and a PhD in philosophy because I really liked paying for my education. So sorry, I'm fixing my hair for those of you that are watching this online because it's a crazy day. What I want to talk about today, the number one hormone imbalance in women across the board, from teens to women in their 70s and 80s, and that is the archetype that I call in my book the NUN, which is testosterone deficiency. Far and away the number one hormone imbalance, low testosterone. Basically the issue being in younger women that many of them are on birth control pills, and birth control pills increase a protein in your blood called sex hormone binding globulin. That hormone, when it's higher, will decrease your free testosterone. Now let's talk about that. Free testosterone. What is a free testosterone versus testosterone? If and when you get a doctor that will actually check your hormones, the interesting thing is a lot of women will come to me with labs that they've drawn somewhere else, and they'll have a testosterone level. The problem with the testosterone level is it doesn't tell you the whole story. There is a testosterone in your body called free testosterone. That is what is chemically active in your body. So the total includes the free, but it also includes something called bound testosterone. So the testosterone that is bound is inactive. So you want a higher free testosterone because the total doesn't tell you if it's active or not. And if you're on a birth control pill, the estrogen that's in a birth control pill will increase your body's production of sex hormone binding globulin, which will then inactivate your actual testosterone and lower your free testosterone and increase your bound testosterone. So women that are using birth control pills are at a setup for low free testosterone. So let's talk about the symptoms of low testosterone, because it's easy to talk about and say, oh yeah, I mean, it sounds like low testosterone, but what is it? What does that even feel like? Now, keep in mind, I've sat with about 40,000 women, maybe 50,000 at this point, and really have had the opportunity to get these stories. And that's why I came up with these 12 archetypes in my book, The Hormone Balance Bible. And the NUN is by far and away the most common hormone imbalance in women because of a lot of things. One I just mentioned is birth control pills. And in older women in their probably from their mid 30s and on up, it's a lot of factors. It's anywhere from sleep disorders to stress to diet, exercise, abdominal fat. I mean, there's all kinds of things, other medications that can really offset the effects of your testosterone. So there's a lot of reasons to have low testosterone. Low DHEA, that's another hormone. DHEA is a precursor in the body to testosterone. But let's go back to the free testosterone and, first of all, like what it feels like to have a low free testosterone. The number one thing that I notice is women that have low testosterone will just talk about fatigue. I mean, fatigue. Especially in the afternoons, around 3 or 4 o'clock in the afternoon, you feel like you want to take a nap. But testosterone is also responsible for drive, desire, motivation. So those people that have low testosterone also just feel kind of meh. They just don't feel motivated like they used to. So people will say, oh, Janice, let's go and do this, or let's go and do that. And you're like, Friday afternoon comes around, you shut your doors and you don't come out till Monday morning. You just don't have the desire to do the things that you used to like to do. And it really becomes a bother because some women they don't like that. Now, I would say none of these hormone imbalances that I talk about are a problem if they're not a problem. Meaning, if they're not a problem for you, like if the fatigue is just something that you notice, but it's not really overriding then you probably don't need to do anything. But if you notice the fatigue is just something that you can't stand, that it's something that really concerns you and bothers you, then I would say at that point it has become an issue, and I would reach out to somebody. So when you check these levels, when you go to the doctor and you say, I want you to check my testosterone, please, 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 because 95% of them will just check a total testosterone. Even the piece of garbage paper, the NAMS certification that many of you will go to a North American Menopause Society trained physician, which in my opinion means absolutely nothing. Actually, it's a red flag in my opinion, because most of them are trained in the paradigm that NAMS wants, which is women don't need testosterone for one thing. But so NAMS providers usually won't check a testosterone even if you ask for it. But let's say they do. Make sure that they check total free and sex hormone binding globulin, because that's the main thing that you want to check. So in my book, I talk about a patient example, and I'm going to just read it because I want you to understand. 5 months after I delivered her first child, 28-year-old Marilyn was concerned that her pre-baby energy levels had not returned. Although she'd restarted her workout routine, she found herself unable to exercise at even half the intensity that she had before. Marilyn had also recently returned to her hectic job at an advertising agency and was finding it impossible to sustain her old pace. She was less interested in other physical and social activities and reported feeling like her libido was basically non-existent. This worried her, she said, and made her concerned for her relationship with her husband. I see this a lot all the time. Women that have low libido, they're actually more concerned about their husband than they are about themselves. And I always say in that instance, having a decreased libido isn't always abnormal. We go through cycles in our lives when we're more sexually active. And so for you to be in a down slope for a while isn't necessarily abnormal. And I always ask when women come in with a decreased libido, are you coming in for you? Or are you coming in for him? Because, well, not that I don't care about him, but I'm more concerned about you. And libido is such a psychological thing. Women, for them to have an increased libido, yeah, if you're horribly fatigued, it's not going to be easy to have an increased libido. However, many women are okay with not having an increased libido. They're fine. It's the men that are making them feel abnormal. Anyways, I was less surprised by Marilyn's symptoms than she was. You're a new mom, I reminded her. Your body has undergone a massive transformation, and your life has too. All of this takes a physical and psychological toll and wreaks havoc with your hormones. Marilyn seemed unmoved, so I went on. As for your sex drive, you transitioned from being a free-loving, sexy wife to having milk leaking out of your breasts while you're up half the night trying to keep up with 500 things you have to do every single day. It's not surprising that physical intimacy has taken a back seat. She seemed to relax when I told her this. Although any one of a series of factors may have been the root cause of her fatigue and diminished interest in sex, testing did reveal that Marilyn's testosterone levels were, in fact, on the low side of normal. We discussed the impact of her pregnancy and delivery on the hormones and how factors including stress and her birth control medication were likely contributing to her imbalance. So you can see where a woman would normally be told, especially at 28 and having a baby, oh, you're fine. Go back and just live your life and it'll come back. And in most cases, that's probably true. But in her case, it was bothersome to her that she wasn't sexually active. And we can be judgmental about that. But the point being is that it's her life. And she was the one that was suffering with this, not me, not any of my staff or you, but it was bothersome to her. So we talked about the symptoms of a low testosterone. We talked about the reasons for low testosterone. You can obviously have menopause. Menopause is going to cut your testosterone levels in half because the ovaries make half of your body's testosterone. Chronic illnesses, Hashimoto's, can decrease your androgen production. Other autoimmune diseases like lupus, rheumatoid arthritis, adrenal insufficiency, because if your adrenals aren't making enough DHEA, then you're going to have low testosterone. Obesity, because obesity raises your sex hormone binding globulin, which, as I talked about before, even if you have a normal total testosterone, that increased sex hormone binding globulin from the fat cells in your stomach can actually increase or decrease your free testosterone. So that can be a problem. Now, in my book, I also talk about the Shines protocol. The Shines protocol is a 6-step process: spiritual practice, hormones, infoceuticals, nutrition, exercise, and supplements. And I would encourage everybody hearing the podcast to actually go get a copy of the book, because you have it as a reference. On page 14, there's a QR code. You can go take my quiz, or you can go to tassonemd.com/quiz and take the quiz yourself. And in the quiz, you will find an answer. Now, keep in mind, it's a quiz. It's not your typical 5-question quiz that you see on everybody else's website. It's 36 questions. And then on the back end, they're all weighted mathematically, because I majored in math in college, and so that's my forte. So it actually is quite accurate, but keep in mind, it's just giving you the hormone imbalance based on your symptoms, whereas the actual labs will give you the data that, we so desperately require. So the spiritual practice for a nun, if you think about it, what do nuns do? Well, nuns, when they're on the negative side of nunnery, when they're cloistered, meaning they stay indoors all the time. So the spiritual practice for a nun, and I say this all the time, is to just make yourself go outside. Get outside, walk in the grass, walk with your spouse or your significant other, and, get your feet in the grass and do something. Even if you don't want to do it, make yourself do it, because the sunshine, it's a mood elevator. It makes you make vitamin D, get you out of the house, just can change your mood. And so can just moving your body. So getting outside, maybe going for a walk, and not cloistering yourself on the inside. Nuns are great when they cloister. Sometimes they do that professionally because they're hiding from society. But the true joy of being a nun is sharing your message with the world and getting out there and doing stuff. So the spiritual practice that I've always talked about with nuns or low testosterone is to go outside, move your body, get out in the sunshine. Hormonally, it's pretty obvious. If you're low in testosterone, we want to raise your testosterone. Now, there are many ways to raise testosterone. There are some horrible ways that are currently being utilized to raise testosterone by companies like Evexius and BioT. They are predatory companies that are preying on women who feel poorly, and they're training mid-level providers, doctors, med-spas, plastic surgeons, dermatologists, people that really have absolutely no business dealing with hormones. And they're telling them that it's normal for a woman to have a testosterone level of 150 or 200, and it's not. And I'm going to say that again. It's 3 times normal. It's malpractice. These companies are training doctors to commit malpractice. Any other medication, if we overdosed a patient, we would lose our medical license. But for some reason, these companies tell doctors all the time they can overdose women on testosterone. Pellets are horrible. I've done a couple of episodes on this. I talk about it all the time, so I'm not going to belabor the point. But testosterone is a horrible way through pellets to increase your testosterone, because it's going to go through the stratosphere. I just saw a lady last week whose testosterone level was 7 times the normal rate for a woman. It was 375, which is in the male range. And her doctor told her she was fine. And actually, that was 3 months after the pellets were put in. I don't even know what her testosterone was 1 month. I mean, my God, must have been 600-700. It's malpractice. And then we look at injections, and I fight all the time, and I'm not going to fight. Women want to do what they want to do, and they say they feel great on their injections and great on their pellets, and you probably do. But you feel great on cocaine too, and that doesn't mean you're going to go use cocaine all the time. It's ridiculous, really. It's an overdose. And the thing with injections, again, you can't have a stable release system, and you give yourself these injections twice a week. First of all, who wants to do an injection twice a week? And second of all, you're going to get this sawtooth pattern because you give yourself the injection, it goes up and then it goes down. So you're going to get this erratic release, and the erratic release on these hormones can increase your blood count and make you need to donate blood. It can cause a lot of issues with clitoromegaly and voice deepening, and some of these issues are permanent. So I wouldn't recommend injections or pellets. And it would be, I guess, it would be okay if that was the only methods that we had, but it's not. You can use creams, you can use sublingual tablets, you can even use oral testosterone, because regular testosterone is actually absorbed mostly through the lymphatic system. So it doesn't actually get too much stress on the liver. So many, many ways to use testosterone. Please stay away from pellets, and please stay away from injections. The fact that they do those things show me that they put profits over patients. It also tells me that they have absolutely no idea what they're doing, and they went to some weekend course where they learned how to do testosterone, and they're simply following a protocol. So hormonally, testosterone, I usually will start with a cream. I'll move to a sublingual tablet if the cream doesn't absorb particularly well. The dosage usually ranges anywhere between 1 milligram and 4 milligrams a day. And I had this argument with a nurse practitioner. This shows you how people don't know what they're doing. And this could have been a doctor. It's not that I'm singling out that she's a nurse, but she was. So she said to me, well, I give my patients 100 milligrams a month on an injection. And she goes, if you're giving somebody 30 milligrams a day or 3 milligrams a day, then you're giving them 90 milligrams a month. And that's not how it works. Because if you think about it, I'm giving you 3 milligrams, and then it raises your level and it slowly tapers, and then you give yourself 3 milligrams again. So you're getting 3 milligrams. When you give somebody 100 milligrams all at once, you're giving them 100 milligrams. Totally different. But you see the logic that these people try to use to justify their overdosage. It's just not a good way to do things. So that's that. As far as the energetic aspect or the infoceutical aspect, sometimes I will send women to acupuncture. If you want to use essential oils, you can use clary sage or something along those lines. Nutritionally, what I find nutritionally for women that have low testosterone is you really need to up your protein intake. I mean, it's plain and simple. Most women simply don't get enough protein during the daytime. And a simple rule of thumb, I'm sure this is arguable for sure, and there's probably people on both sides that would argue this, but a general rule of thumb is about 1 gram of protein per lean body weight, meaning if you have 145 pounds of muscle or 130 pounds of muscle, then you use about 130 milligrams of protein. I usually tell women to shoot for about 100 to 125 grams of protein. My guess, most women are probably getting 30 to 60 grams a day. You're just not getting enough protein, and that protein is going to help. If you want to increase your testosterone via working out, you can do high intensity interval training, meaning, sprints and things like that, where you work out really hard for 30 seconds and then you stop and relax, and then you do it again, and then you kind of keep going up and down like that with your bursts. You could lift weights. Weightlifting is obviously probably one of the best ways to increase your testosterone level. However, it's hard to do that, and hard to increase your testosterone through working out if you're tired and you can't work out. So it's a double-edged sword, and I get that. But that would be one way to do it. And the reality is, women will then ask me too, like, well, do I need to stay on this for the rest of my life? And the answer is no. The only hormones you need to live your life are cortisol and thyroid, because if you didn't have them, you'd die. Testosterone obviously is not a hormone that you need to sustain your life, but you may want it in your life to feel better. And in most cases, if you've changed what you do, like if you've lost 30, 40 pounds, if you're working out more, you may not need the testosterone. And so we can always check and see what your levels are. And worst case scenario, if you stopped taking it, you'd probably go back to where you were before, meaning low normal, which is fine. It's a place you can live. There's nothing wrong with doing that. It's just that you may not like how that feels. So something to keep in mind. So supplements then for raising testosterone, and none of these, I will say, have like ironclad research to show they actually do this. And there's a lot of false claims out there. The supplements that are probably helpful are going to be one is maca. I talk about feminescence all the time. I'm a huge fan. I think it works great. The two that haven't really panned out are Tribulus and Tongat Ali. You'll see a lot of people like Huberman and some others that really talk about Tonga Ali because they are being pushed by the companies that are paying them to say that. There hasn't been a really good study that shows that Tonga actually really increases. The studies that Huberman talks about, which is a classic Huberman way of doing things, is you find some esoteric study that had like 19 patients in it where there was a slight increase in testosterone, and then you use that because you have a platform and you have this PhD, people automatically assume that you're telling the truth, and in most cases you're not. Zinc is possibly does have some research to show that it can increase testosterone because zinc is utilized by your body to make testosterone. So I will usually defer to actually giving the testosterone, but there's some evidence out there for nettle extract and long jack and ginseng and saw palmetto. DHEA obviously will do it. DHEA I would not consider. I personally don't consider it a supplement. It's actually a hormone. Why it's able to be sold over the counter, I have absolutely no idea. So to recap, testosterone deficiency is far and away the number one hormone imbalance in women across the board, across all age groups for various reasons. In menopause, it's because your ovaries stop producing 50% of your body's testosterone. In younger women, it tends to be lifestyle related, sleep related, other medications, diet, weight, and also birth control pills. So there's reasons at different ages for this deficiency. That being said, I prescribe testosterone all the time. Unfortunately, testosterone is a controlled substance. And unfortunately, the only way that you can replace testosterone in a woman is through compounded hormones, because apparently the FDA doesn't think that women need testosterone, even though it's the number one circulating hormone in your body, volume-wise. They don't feel like women need testosterone. So guess what? They have never approved a testosterone replacement for women. To me, that is the utmost in misogyny. You can see it, there's like 12 for men, none for women. And that's the other question I get. Oh, my husband's on androgel. Can I use androgel? No, it's too concentrated for women. And again, it's going to make your levels go way too high. So the way you want to get your blood checked, you want to make sure you get the free and the total testosterone with the sex hormone binding globulin. It's a blood test. You can do urine. The problem with urine testing is it doesn't give you the free value. It just gives you the total. So it's not the whole picture. It also won't give you the sex hormone binding globulin, and urine really won't check thyroid very well, and it won't do vitamin D. So I would just check with blood. The replacement therapies for testosterone, cream, sublingual tablets, and oral capsules, I would stay away from pellets and injections at all costs. I think those are red flags, and providers that are putting those in should not have patients. So you can find me on Instagram at Sean Tassone MD. You can come over to YouTube, Sean Tassone MD. I have a YouTube channel. I do YouTube lives every day, usually between 3 o'clock and 7 o'clock CST, so Central Standard Time. I answer questions every day. I do a Q&A on Instagram every Saturday, and I'm always around. The second pinned post on my Instagram page also has all of the states where I'm currently licensed. I'm in California, Florida, Texas, Louisiana, Kansas, Oklahoma, Utah, Colorado. I mean, there's a lot of states that I'm in. And if I'm in your state, then I can see you via telemedicine. We draw blood. We'll order it at a Quest or a LabCorp in your area. We'll set you up with an appointment. We'll do the appointment on Zoom, come up with a care plan, and then usually only have to follow up with you once every 6 to 12 months after that. I hope you all learned something today about testosterone. Have a great one, and I'll talk to you next time.